Most people think if you are an adult, you only see adult cardiologists, cardiac vascular surgeon. But if you're born with some kind of congenital heart disease, many times you end up in a pediatric department. Is that true?
Yes. There are, in fact, more people with congenital heart disease over the age of 18 than under the age of 18 now. And the reason for that is people with congenital heart disease are living longer than they ever did before. The surgical techniques are getting better. The care for these patients have improved tremendously as we've learned over the last several decades. And so we now have a growing aging population of patients with congenital heart disease. The training for congenital heart disease is primarily done in the pediatric cardiology training programs. Adult cardiologists do not learn very much about congenital heart disease as they're going through their training, and their exposure to congenital heart disease is limited for the most part. So there is a growing need to train cardiologists to deal with adults with congenital heart disease. And until that training comes to full fruition, it is in the best interest of these patients to remain under the care of a pediatric cardiologist who is fully trained and used to taking care of patients with these complex problems. And this may be done in conjunction with adult cardiologists and an adult internist so that the whole patient is cared for in an appropriate manner.
So there's a great overlap for a reason, because you're trained in an area, they got a little bit bigger, but they still have a disease which they were born with.
Exactly.